A common question I get asked about are the symptoms of hepatitis B. What are these? There are things that are specific that can tell us that one has got hepatitis B? In as much as there are no specific symptoms, there are some that are quite common. I had mentioned at some point during this series of lectures that hepatitis B comes in two forms, acute and chronic. The acute hepatitis B is more dramatic and so can come with symptoms that are more robust than the chronic one. For this, that's the acute infection, these are some of the few symptoms that I will highlight. Abdominal pain. Now, this is likely because the liver is inflamed and the feeling of unwell, and so there's a bit of pain in the abdomen. The second one would be the urine turning dark in color, and this is something that can cause an alarm to the patient. And then temperature, fever will be present, and this is something that's high, may lead to a lot of sweating for the patient as well. And then lack of interest in food. The patient will not want to eat anything at all, and that is a common symptom. Loss of energy and fatigue, tiredness, and then very dramatically, jaundice. Now remember that jaundice is not a symptom of only one disease, but hepatitis can cause that as well because the liver is not functioning properly at that stage. In summary, I've talked about a few symptoms that can be found in patients with acute hepatitis B. I will spare you the trouble of going into the symptoms of chronic hepatitis B, as those ones actually present with nothing to the severe complications. I'll stop at this point, and I hope you are actually able to follow on to learn a bit more in subsequent lectures. Thank you.